Great. I think we should be able to start now. We have 47 participants who've joined us so far, so we want to start. We had an RSVP of about 200, so I'm expecting more people to join. Good afternoon, good morning, good evening, wherever you're joining us, and it's a very warm welcome to everyone. My name is Karen Bett. I'm a policy officer with the Global Partnership for Sustainable Development Data. I will be your moderator for this webinar. I would want to just start with a little bit of logistics. We have simultaneous translation for this webinar available both in French and Spanish. So if you go to the bottom left of your Kudo window, you will see a white button which says flow. If you click on it, you can select the language you prefer. So English, French, or Spanish. English will be the language on the flow. Also, just to let you know that this webinar is being recorded and we'll be sharing the recording after this. If you have questions or during the webinar at any time, if you have questions, please use this chat button. It's called messaging on the Kudo window. It's to your top right, second from the list. So please drop your questions in there, and when we get to the Q&A, we'll be able to pick the questions from there. Just to also let you know that we'll run a poll towards the end of this webinar, just to get your feedback on how this webinar went. This webinar will run for 1.5 hours. So we're aiming to end it at 8:30 Eastern time, which will be 3:30 p.m. Nairobi time and about 12:30 p.m. GMT. We have, as I mentioned, about 47 going to 50 participants so far. We're expecting a lot of more people to join. Just a little bit before we get into the details about the purpose of this webinar, it's really to highlight the efforts of 5 countries, Argentina, Chile, Namibia, South Korea, and Tunisia, that have worked to improve their public sector service delivery based on universal registration and ensure that their citizens and residents have documentation to access service. We'll be able to hear from 2 of these countries today, Namibia and Tunisia. Just to let you know, we're running this webinar in 2 parts. So webinar 1, of course, is today. We will have webinar 2 on the 22nd of September, same time, which will explore the role that integrated civil registration and social protection systems can play, particularly in a pandemic like we are in right now with COVID-19. For this webinar, I have an expert panel of 4 speakers to bring this conversation to life. I have Annette Fossingdal from IDRC, Mia Habits, an independent consultant, and I have Chulumeke Munyika from Namibia and Porat Judi from Tunisia to share the country case studies. Just to let you know, also these case studies have been published and all available on the Center of Excellence website, and this will be posted also on the chat shortly. A little bit of the run of show. We'll start with some intro remarks, and then I'll invite Mia, Tuli, and Porat in that order to make presentations. We'll go into a Q&A of about 30 minutes and wrap up this webinar. Without further ado, I'd like to invite Annette to give some opening remarks. Over to you, Annette.
Thank you very much, Karen. Hello, everyone. Thank you so much for joining this webinar. We're very excited to see so many of you today. By the end of yesterday, we had more than 200 who is registered. My name is Annette Fossingdal. I'm a senior program specialist at the Center of Excellence for CRVS system, which is hosted under IDSC, and we are based in Ottawa in Canada. So on behalf of the Center of Excellence for CRVS System and the Global Partnership for Sustainable Development Data, it's my absolute pleasure to welcome you all to this first webinar of 2, focusing on our latest compendium titled The Nexus Between Civil Registration Social, and Social Protection System, 5 Conflict Practices. Compendium builds on the recommendation of our innovation workshop in February 2018. At that point, we were asking our participants to identify knowledge gap in the field of CRVS. one of the key knowledge gaps that the conference identified was the lack of information about innovative and tested practice that increase civil registration rates and has provided pathways to social and economic inclusion through legal identity. So the overarching purpose of this publication is to bring to attention innovative practice from 5 different countries, very different countries in Africa, Asia, and South America, that has all true to promote inclusive development based on the foundations of very well-functioning civil registration systems. And we sincerely hope that these country cases will be able to provide guidance to policymakers and professionals working in the field to both improve the civil registration, but also social protection and how these two systems interact. So the relationship between civil registration and social protection are two-way. Both systems need nurturing to function. So individual is well known without trusted identity credential can normally not access social protection benefits. And on the other hand, social protection schemes provide incentive for individuals to register their vital events. For governments, they need trusted civil registration systems and documents so they can limit inefficiency, mismanagement, and corruption in the distribution of social benefit. So both civil registration and social protection system are critical in the way they work together in order for us to achieve the sustainable development goals. Discussion, as already mentioned by Karen, is absolutely current now while we're in the midst of a pandemic. By the 1st of May 2020, 159 countries, and that is out of 195 countries in the world, had planned or had ongoing social protection schemes to respond to the negative effect of the pandemic. And many of the countries that do have responses do not all have civil registration systems. So we really hope that we will be able to show you the nexus between these two systems and how they can be built simultaneously. With these few words, I would very much like to just wish you a good webinar and I will see you later. So I will hand over to Karen. Thank you very much.
Thank you so much, Annette, for those introductory remarks. I'd want to just move quickly to the presentations, and I'll start with Mia. And maybe before Mia comes in, I'll just want to also request Forat to just make a request to join the floor as a speaker. Mia, over to you. Colin will share your slides. Thanks.
Hello, everyone, and it's a pleasure to be joining you this morning from Washington, D.C. Just a little bit about my role. I have been coordinating this study on behalf of the Center of Excellence for CRVS and had the opportunity to work with the different authors, and I will just be giving a very brief introduction to what we were looking at and the importance of linking civil registration with social protection systems for a number of reasons. It is difficult to overstate the significance of civil registration, especially with regards to birth registration as the first step on the road to legal identity and access to benefits and services for all. Civil registration is the chronicling of vital events, births, adoptions, recognitions, marriage, divorce, deaths, events throughout a person's life and it's the recording of his or her biographic information in official records created and managed in a country's civil register. The information can also yield governance tools, such as demographic and vital statistics, especially important now in the COVID pandemic. Social protection systems are the policies and programs designed to reduce poverty and vulnerability by promoting efficient labor markets, diminish people's exposure to risks, and enhance their capacity to manage economic and social risks such as unemployment, exclusion, sickness, disability, and old age. According to Albert Schweitzer, it's not enough to merely exist. In times past, it was not always necessary to have identity credentials to fully function in society. On the other hand, throughout history, rulers and authorities recognized the need to record information on what could be considered their most valuable asset, namely their people, whether this was for collecting taxes, secure a study. Can you go back, please? Securing a steady supply of workers and slaves or conscripts for waging wars depended on the circumstances. Identity is a question of belonging and of accessing societal benefits and obligations. How a country manages civil registration identification is often established in a country's constitution. A person's legal identity is underwritten by the agency that is lawfully authorized to issue the official identity credential based on information validated by the same authority, whether this is a birth certificate or an identity card. Having this identity credential is in itself insufficient to access benefits and services unless this link has been established by law, regulation, or decree. Next slide. Having an identity has always mattered in one way or another. Social identity through genealogy, the belonging to a family, a clan, a tribe, or land is fundamental, especially for tribal or indigenous societies. It can be argued that the French were the first to institutionalize modern civil registration by moving registration of births, marriages, on deaths from the church to the public or municipal sphere in 1792 with the objective of registering the whole population. Taking a more narrow look at more recent history, there has been a more focused and global approach toward legal identity that started with the passing of the Universal Declaration of Human Rights in 1948, followed by conventions such as the Social Security Minimum Standards Convention of 1952, the International Convention on Elimination of All Forms of Discrimination against women of 1979, and Convention of the Rights of the Child of 1989, to mention a few. When I myself started working on registration and identity as conditions for development, late 1990s, there was only one publication by UNICEF that was found. However, the September 11th attacks set in motion a whole new interest in the uniqueness of identity from a security point of view. And with the spread of internet, publications on digital identity and the need for trusted and trustworthy authentication started appearing. However, development organizations started picking up on the importance of civil registration and identity as well. So fast forward to 2015 and the SDGs that focuses on both social development, but also takes governance and legal identity into consideration. It's notable that at least 72 of the 232 indicators directly depend on or are related to target 16.9 that calls for legal identity for all, including birth registration. Next slide. It is difficult, if not impossible, to put a number on the cost of lost opportunities for the individual, as well as reduced planning capacity and loss of revenue for the state, as Annette alluded to. The impact may be felt in growing inequality and even as a downward spiral, as highly unequal societies are less, especially as highly unequal societies are less effective at reducing poverty, grow more slowly, make it more difficult for people to break out of the cycle of poverty, and may hinder economic and social advancement. For government, the cost of lost or never collected information for planning and public policy is enormous. Benefits and services cannot be targeted to those who need it the most, because those who are without a legal identity or without identity credential cannot access in most cases. So who are the people who lack identity credentials? Since 2015, the World Bank, through ID4D, Identity for Development, has been managing a database that is looking at all the different databases or systems in countries, 198 economies, to figure out how many actually are without a legal identity or identity credentials. And the number is about around 1 billion individuals. And if you don't know this database, I strongly recommend you check it out. Next slide, please. Most governments are keenly aware of the need and the conditions that have to be in place for improved socioeconomic development. Balancing effective governance with the capabilities and needs to meet society's demand requires both resources and institutional building, a tall order for many countries. Well, in this case, we have looked at 5 different countries. There is no one-size-fits-all model for countries aiming to modernize their registries and reduce poverty. There is no unique model that will break the cycle of exclusion for the most marginalized and ensure access to social protection and to the fair and equitable distribution of benefits. It is a balancing act all the way. Good governance is at times more of an art than a science. Governments that have undertaken reforms leading to greater access and inclusion have pursued this in a variety of ways. but two ingredients are common. They have focused on strengthening institutions and relying on timely and good quality statistics. A virtuous cycle for this particular subject that we're looking at here can be the strengthening of civil registration, which implicitly leads to better vital statistics, which can provide better foundation for decision-making and planning, also in the social sectors. Next slide, please. Countries with the highest estimated percentages of undocumented or non-registered residents are also among the most fragile. These tends to have the weakest institutions and the fewest resources to break the cycle of invisibility, exclusion, and poverty for those without legal identity credentials. The Center of Excellence made the decision to move for anecdotal evidence to assess successful practices that improved access both to civil registration and had a positive impact on social development and poverty reduction. And why these 5 countries? Well, these countries are, culturally and politically, geographically far apart, except in the case of Argentina and Chile. But there were 5 common strategic elements that they had in common, and that contribute both to increase civil registration, but also linking civil registration with social protection schemes to include more people and lift more people out of poverty. And these are the political will, the linking with including strengthening of civil registration in national development goals, managing to coordinate among key stakeholders and agencies, and there tend to be quite a few of them involved in the production and use of the information, quality and also accessibility of the registration services, and then the stability over time. Next slide. Unfortunately, Chile, the author of the Chile study, Ivan Arkozaks, is not able to join us. But Chile is quite interesting that it grew out of the system they have today, grew out of the change from a military dictatorship in 1990 and the reconstruction of society that fostered a new relationship between state, private sector, and civil society. And in this, the focus was on strengthening the capacity of the public institutions to serve people. The civil registry as it is today encompasses 32 registries, starting with civil registry and birth registration when every Chilean or every child born on Chilean soil is issued with a unique identity number. Next slide, please. Also, the processes for civil registration, civil identification, and the issuance of identification documents are being designed along with the right incentives. People will join. And Chile was also, with the civil registration and identification system service in place, They were able to use the information there when they created one of the first conditional cash transfer programs in Latin America, Chile Solidario. Most of the other conditional cash transfer programs in Latin America are based on the Chilean model. But the first thing people had to do in order to apply for the cash transfer program was to register and obtain their unique identity number. And it has become an integrated model over the years. And today, the delivery of social services is based on a unique legal identity, a unique password that is issued by the Chilean Civil Registry Service, as well as a social registry of households. And this is a model that is really trusted both by people and across the public sector. And the Chileans themselves, their legal identity or their unique identity numbers are really important to them, to the point where in order to really prove who they are or really emphasize points in the op-ed pages in newspapers, they will actually sign with their name and their unique identity number. Next slide, please. The South African Archbishop Desmond Tutu described the importance of timely birth registration as a matter of life and death. To quote him, "The unregistered child is a non-entity. The registered child does not exist. How can we live with the knowledge that we could have made a difference?" Ensuring not only legal identity through registration, but also the access to rights, services, social benefits, civic participation is what the government in the 5 country cases have done. And we will learn more about Namibia and Tunisia today. But another thing that these countries have in common is that it takes time. These processes to integrate civil registration with social protection programs to improve access, to reduce poverty, take time, decades. It is not enough to just throw an identity credential at people. And this study is more of a qualitative, or this compendium has more of a qualitative aspect to it. And what is clear is that we also need to have more quantitative research to really prove causality. But I think the country cases will speak for themselves on the advancement these 5 countries have done. Thank you very much. I hand over to you, Karen.
I think we lost Karen for a second, but she's rejoining now.
Just for the technical hitch on my end. Thank you so much, Mia. I think I like the passing thought where you said this it won't happen overnight, but it's an investment of decades, maybe 10 years, maybe 20, maybe 30, maybe even 40 or more. And I think the common elements around political will, aligning to national goals, coordination, I've had that many times, and also just the quality and accessibility of these services, and in addition to the stability, are the key ingredients or the key factors of success. Well, I'd want to invite now the country authors to take us through their country experiences in just strengthening country systems. I'd like to start with Tulimeke Munyika from Namibia, and then after Tulimeke, I will invite Porat to make his presentation for Tunisia. Just for the just to check again on Forat, if you can just request to speak, we can add you to the floor when it's time for your presentation. That would be good. Tulimeke, over to you.
Thank you very much. And good morning, afternoon, and good evening to everybody that is tuned in. Thank you for joining us. I'm Tulimeke, and the part that I'm going to present is a case study of Namibia, which is the synergy between civil registration and social protection. And this is a chapter that Annette Forsingdal and I did in the compendium that Mia has just given a summary of. Can I have the next slide? Thank you. Okay, just to start off, I just want to highlight some of the high-level commitments that Namibia has as part of poverty reduction. Right on top, we have the Vision 2030, which really is the document that straight on set out to reduce poverty in the country. Oh, I hope I'm speaking slow enough. And the next one is that Namibia has had national development plans that span out for about 5 years. The 5th National Development Plan that we mostly call NDP5 is the one that is currently running. And it clearly indicates that Namibia wants to improve the living conditions for all with a specific target of reaching 95% of birth registration immediately after birth. And this is targeted to be achieved by 2022. One of the national agenda policies that we have is the National Agenda for Children, which went up to 2016 and really just focused on improving the livelihood of children and making sure that they are pulled out of poverty. We also have, as the 4th one that I've listed here, the e-governance policy. The importance with this e-governance policy is that it indicated that the National Population Registration System, which is the system that houses the population register, is a cornerstone for e-governance for all the different spheres in society, which would include social protection as well, among many other things. So this is key. If e-governance is supposed to be achieved the way that Namibia has set out to do it, then the NPRS is a cornerstone to achieving that. Then this one is very close to my heart. The Civil Registration and Vital Statistics 5-year strategic plan, it just ended this year. This was the first time that the different role players in CRVS actually came together and sat around the table to come up with what needed to be done in those 5 years so that we can achieve comprehensive civil registration and vital statistics coverage. This strategic plan had set out a steering committee plus a technical committee. These committees go into the nitty-gritties of what exactly needed to be achieved. And there it became very clear also how CRVS would be quite important for social protection. There is also a blueprint on wealth distribution and poverty eradication of 2018, which also identified the need for national documents in order for people to access the social protection nets. Next slide. Is it Colin or Karen? Great. We will just set out now the legal and institutional framework is for social protection in Namibia. There are a number of legal instruments that set out social protection and provides for certain grants. The Pensions Act is one of them, which provides for pension and also grants for blind people and for people that are disabled. There is also the Child Care Protection Act, which is an act of 2015. It replaced the previous Children's Act, and it also deals with a number of grants, specifically for children and also for foster parents who take care of children. In the year 2000, there was a cash grant that was introduced for orphans. And specifically, it was in response to the many number of children that were left orphaned due to the HIV pandemic. And for accessing that grant, obviously, it goes without saying the children will need to be identified. For veterans of the liberation struggle and their children, there is a Veterans Act that is in place, which provides for the grants that they are entitled to for the contribution they've made towards the independence, the gaining of independence for Namibia. There are also other protection nets that are in place, maternity leave benefits that are administered by the Social Security, as well as private medical aid funds that a person would only be able to access if they had some form of identification for themselves. But these are among some of the main social protection schemes that we have in Namibia. I just wanted to highlight that in March this year, there was some reorganization of the structures that we have in place. The ministry that was responsible for child welfare was merged with the one that is responsible for social welfare. And this really puts together more social grants under one roof, which leads to less structural fragmentation. So this is now under the Office of the Vice President, which is very high level. It shows how serious the issue of social protection is taken, that is elevated to the level of the Office of the Vice President. On the next slide, I'm going to just deal with the with the civil registration framework. If I can move to the next slide. And we'll also just set out both the legal and the institutional frameworks. Most of us would know that for civil registration, the role players would be those that are responsible for civil registration, health authorities, justice/judiciary for us, and on the vital statistics aspect, extremely important that the statistics agency is also on board. I'll just quickly highlight on the legal framework. I won't deal with all the many acts that we currently have, except to mention that the Civil Registration and Identification Bill is currently on our tables, which is going to consolidate the different pieces of legislation that we have standalone that deal with civil registration and with identity management. Really, the point is to have to bring all the CR and identity management provisions under one roof for better management, to enhance how we deliver services on CR and identity management. What it's also going to do is to provide clearer provisions on data sharing and verification procedures for both public and private sector. We'll see a little bit later on that at the moment, it's only really private sector that can access the information that is contained in the civil registration system, but it will become much, much clearer. It will become much seamless when this new law comes into force. Okay. I am now just going to quickly deal with how the CR system has been used in social protection programs. For most, if not many of the social grants that we have, you would have to show proof of Namibian citizenship or being a permanent resident in the country for you to be eligible to receive a particular social grant. And for all of them, you would need to show positive proof of your nationality. Are you really who you say you are? Are you the age? Have you reached a certain age that will make you eligible to receive a particular grant? Are you 60 years old for you to get a pension, or are you a child for you to be able to get a grant that is meant only for children? And obviously, the verification of the status, dead or alive status, of the person that is claiming to get a particular benefit, and also whether a particular event such as a death of a person on whom you have been dependent has taken place so as to enable you to get the grant that you apply for. Importantly, your birth certificate, a marriage certificate even for that matter, and an ID would be very, very important for you to be able to access those social grants. In the next slide, I still continue with how the civil registration system has been used in social protection programs. If you can give me that slide, thank you. Mia also spoke about that when she highlighted the 5 similarities that you would find between the 5 countries that were part of this study, is that there has been coordination, improved coordination between the stakeholders that are involved in the subject we're talking about. In Namibia, it has definitely been the case. There has been improved coordination between civil registration authorities as well as the authorities responsible for social protection. What has happened over the years is that we have now set clearer procedures, especially for the registration of foundlings and abandoned children. There is a new outreach model that we have, which is integrated. It takes, when you go out at once, you have your civil registration authority, you have the health authorities, you have social protection, which would be mostly child welfare, going out at the same time, of course, including the police to administer oaths for people to make statements. And all these 3 services are administered at once to be able to assist the members of the public to access services much easier. And that goes to show that interconnection between civil registration and the social protection programs. There is a new grant system that is being developed that is going to be a direct link between the civil registration system and social protection. And we're working on this. It's a work in progress, but so far a number of memorandum of understanding have been signed between the civil registration authorities and other authorities that are responsible for social protection. And this is mostly on data sharing. How do we go about sharing data in such a way that our system as a country is running smoothly, that we don't really have a lot of standalone systems? And the ultimate aim is, let us do the best that we can together, pulling in one direction so that we can reduce poverty in the country. We're very excited that in the next couple of months, together with UNICEF, our very close development partner, we should be able to reach out, go into the regions that we know have the lowest birth registration rate, for us to try and ascertain, do an assessment, what exactly are the barriers that exist in those particular regions to birth registration. Why is it that we see the birth registration rate is quite low in these regions? These regions are also the poorest according to the statistics that we have. So with this one also, the point is really to be able to find what are those barriers, find a way to remove them so that we can administer social protection better using the civil registration system, which, like we've seen in the previous slides, is really the cornerstone. Okay, what is my next slide? Yes, what have been the key reforms that we have had to undertake in order to improve the civil registration system for it to be able to achieve all these things that it is now able to achieve today in social protection administration? Before independence, that is before 1999, vital events were registered in separate registers, and these were also organized according to the racial groups. And the registration was also mandatory, so you can imagine that by the time you take the books and you want to be able to do something, the majority of people have their births not registered, and this is what was evident in the early 1990s. About 75 to 80% of the population had their births unregistered. Now, this meant that the registers in place were not really very comprehensive in assisting the country to put up plans on how to deal with some of the issues. And for that reason, mobile birth and ID registration units were dispatched countrywide in order to go out and register people wherever they found themselves. Around the 2000s, the Civil Registration Authority had reached a point where 23 hospital-based offices had been opened. And this was in response to problems that were identified at the time, that civil registration moved closer to where children are actually born, and offices were opened in rural communities to enable those who are unable to reach towns for them to be able to also have civil registration services. It also saw a better cooperation between the health authorities and civil registration authorities, that's the Ministry of Home Affairs, and the expansion of the structures. Fast forward to about 2010, digitalization took place. We then saw the development of an integrated national population registration system, which saw civil registration and identity management being merged in one system, which made administration quite smoother. The NPRS was designed with an interoperable framework that is called the X-Road, which allows for safe exchange of data in the system. It's designed in such a way that other systems that are administered by other ministries would also be able to connect to the NPRS. All the historical records were scanned. And one important thing that happened is that electronic birth and death notification systems were also introduced to ensure that all vital events, well, births and deaths at the moment, are notified as soon as they occur to secure the evidence that they have taken place. We had a turnaround strategy project that ran and that resulted in really strengthening the institutional capacity of the whole ministry. So even for finance, for administration, if you may, the support system around civil registration was also strengthened. It resulted in shorter turnaround times, making sure that the processes were made clearer, they were reviewed, and the staff members were trained in the legal framework that is applicable to civil registration. So these initiatives were key in making sure that the civil registration system is improved. It is not, we have not arrived yet. We're still doing a whole lot of work to be able to make sure that we continuously have a system that is improving and adapting to the changes, especially in technology. We can move to the next slide. Okay, what have been the results? And this is my second last slide, if I'm not mistaken. On the CR indicators, birth registration of children below the age of 5 has increased from about 73% to 88%. We have also seen that death registration has also increased, with us standing at 93.7% in 2016. In the same survey of 2016, indication is made that 82.9% of the population is in possession of identity documents, and if you compare that at the beginning of 1990, the birth, that's the about 75 to 80% was not registered. So you can see that the improvement has been quite tremendous. I just want to quickly highlight and show exactly how having a very functional CR system assists in the administration of social protection, even in cases of emergency. We have been under a state of emergency since the COVID-19 hit us really bad at the beginning of the year. And during this time, an emergency income grant was introduced. And this has really shown us that having an integrated CRVS and ID system is a critical component in service delivery, because during this time, every applicant for the emergency income grant was timely verified against the population register. Although interoperability would have been possible between us and the Ministry of Finance that administered this grant, it was not used in this particular case because a private entity was given the responsibility by the Ministry of Finance to administer that grant. Because of legal limitations that we have, that we can't really open up with the private sector to share information in a manner like that. The information was run, the verifications were run by the Ministry of Home Affairs and the Prime Minister's office that is responsible also for that system. What we saw also there is that people became quite aware that a national document is important to enable you to access social grants. Those who were not in possession of IDs at the time were rushing to have their IDs issued because they needed to access that emergency income grant. So the link is actually very direct between CRS and the social protection. And then in the next slide, I continue to deal with the results that we have seen to date, especially on poverty reduction, how poverty has reduced with the use of the CR system that we have. Many people are now able to access cash transfers directly because they are in possession of national documents, and this directly leads to the reduction of poverty. We have seen information we have from 2019 from IMF is that since independence, poverty has reduced from 60% to less than 20%. I mean, you can imagine having to reach that is not an easy task. And also between 2006 and 2014, child welfare grants have also increased with about 40%, and that is also from the same study. Pension has reduced poverty by about 19% and inequality by about 2%. So we can see directly with the figures as studies are being done that there is a reduction in poverty as we are increasing access to civil registration for our inhabitants. Yeah, I think that is my last slide, right? Let me just see if there's anything else after that. Voila. Thank you very much. That is what we can share with you from Namibia on what we have done to date in order to improve our systems and in order to make sure that the social protection systems are benefiting from the CR system that exists. I thank you very much.
Thank you. Thank you so much, Tuli. That was really interesting and quite detailed. I think I really enjoyed listening to, of course, the results, but also the ongoing work of reaching the unreached in the spirit of leave no one behind and making sure we understand the barriers. I've seen the questions have been streaming in for Namibia, but I encourage people to continue sharing the questions through the chat. And just for the benefit of participants who've joined a little later, we're running this webinar in both in English, Spanish, and French. If you'd like to hear your preferred language, you'd go to your bottom left white window, which shows flow, and you select your preferred language there. We will just now welcome Forat Dridi from Tunisia to make his presentation on the country experience. He has about 15 minutes, and Forat will be making his presentation in French. So for English speakers, you can use the button on the bottom left to select English and listen to this presentation. I encourage you again to please share your questions through the chat button, and we'll come to that right after Forat's presentation. Forat, I hope you can hear me loud and clear. Over to you.
So I imagine that you've glanced at my presentation. I imagine that you've looked at this case with regard to Tunisia. So what I suggest is that I analyze or explain the way in which Tunisia was able to establish a system in order to register civil status. And there's going to be a social protection system, which will be quite efficient and quite obvious. So to begin, in order to have a better idea with regard to the development or how this system was actually established, I would like to remind you of the situation very quickly. In the middle of the 50s, next slide, please. So, in fact, there are certain things that are lacking on this slide, says the speaker. So you can see that the heading of the slide was before independence. In other words, up until roughly 1955. So the registration of births was done out of choice. In other words, it wasn't obligatory. It wasn't obligatory for nationals. And the administration, the colonial administration, then only asked for Europeans to register births who were living in Tunisia. And so for the nationals, it was optional. One must say that anyway, most of the births with Tunisians were registered, but often with a 2 to 4 years delay. And there's a reason for that. The reason for that is because at the time, the families considered that if the child had not gone through the awful illnesses, contagious illnesses, such as mumps and so on, in other words, childhood illnesses, the family didn't feel that the child needed to do anything. In other words, he could have his tuberculosis or his mumps, and then they felt that the child had survived, and so therefore then they felt they could register him. In other words, when he'd overcome those childhood illnesses. And very often we had that up until the 60s, and most of the children, in fact, that were in school had between 2 and 4, or they're 2 or 4 years older than their real date of birth. Because, of course, when they were recorded or registered, then they would take the date on the day that they were registered. And so, therefore, there was a recording or there were some few funerals where people hadn't actually been registered, and marriages and divorces at the time where it was absolutely traditional, and it was a tradition for there to be simple statements in front of a notary. Next transparency or slide, please. Thank you. So in 1957 to 57,
au cours desquels nous allons constater un changement radical. L'enregistrement des naissances est obligatoire à une écrasante majorité. On trouve, et d'ailleurs c'est ce qui se passe jusqu'à présent, la plupart des enfants non enregistrés sont ceux qui sont nés de Tunisiens nés à l'étranger, les enfants nés à l'étranger, et la plupart du temps avec le conjoint qui est étranger. Donc il y a une certaine de paresse pour aller vers un consulat et enregistrer un enfant dont au moins la mère est étrangère. Mais sinon, y compris à l'étranger, il y a, je crois qu'on est proche de 100% des naissances qui sont enregistrées. L'enregistrement des mariages, il est systématique, puisqu'il ne peut se faire que uniquement sous l'égide des municipalités.
Registration of marriages is compulsory. The same for divorces. Divorces can only be declared by a tribunal. The result is that we have an identity card which is compulsory, but which is also unavoidable. Indeed, today it is impossible to do anything without having one's national identity card. And this is compulsory for everyone starting at the age of 18. Next slide, please. Besides the case study as such, I think it is very interesting to have a look at what contributed to the success story of this registration system on which the social protection system is going to be built. So we should try and see what lessons to be drawn from this exercise. And the first lesson, and this is something that Mia already referred to, as well as my colleague from Namibia, without political will, nothing would have been made possible. The public authorities under the French influence were very early aware of the importance of civil registration systems and statistical data, with a policy that expressed itself very early. As of the first months of the independence, we had policies that laid the very foundations with the marriage and all the things that are related to that. This was also expressed in a series of laws and legislations. The idea is to impose new things to citizens, and citizens had to get used to this new situation. But at the same time, we had an administrative centralization, a real effort and a real coordination between the different institutions, Ministry of Justice with tribunals and courts, the different municipalities through municipal offices, districts, different police stations, cooperation, and of course, lots of efforts regarding resources, investments for infrastructures, because we had to build the tribunals, police stations, agencies everywhere in the country. We had to staff them and to bring the necessary equipment there. Next slide, please. Next slide, please. While waiting for the next slide, there is another lesson that I would like to share with you. Obviously, the implementation of a CRVS system is part and parcel of a development process. This process has to be understood in the framework of the development approach, a development strategy that we want to implement in a given country. We all know that if the population is not involved, we all know that if we do not involve the population, the results are not going to be very good. They will be mixed, they will be lukewarm. So we have what I would call undeclared and informal contract between the communities and the state. Can I have the previous slide, please? So between the state and the communities. Thank you. In exchange for an involvement in this administrative process, because at the end of the day, the fact of recording birth and death is an administrative process. And for the people to get involved, you have to give them something in exchange. You have to give them kind of a promise that their living conditions will be better. By taking part in this CRVS process, they will have a social benefit. It's going to be an added value for them. Next slide. So we are referring to Tunisia here, of course. And in the first years that followed the independence, we had this huge request for education. And the state answered. The state opened schools, created roads, built infrastructures for people to access the schools. And while answering to that request for more education, the state asked the population to take part in the system through the obligation of providing a birth certificate to register at school. And as people wanted to put their children at school, as of the birth of their child, they went to the municipality to register that birth immediately. They didn't wait for a few weeks to register the birth. And they could also be exposed to penalties, and they could even be threatened to go to court if they exceeded that deadline to register the child. And if they exceeded this deadline, they had to go to the court, to the tribunal. So the tribunal then would issue the certificate, but then it becomes a very heavy system, a very heavy administrative system. And that's why the families always stick to that deadline and registered the child in due time. The same is true for health. The Tunisian state developed a real strategy or policy to fight against maternal and infant mortality. The state gave to each pregnant woman a health record. Can I have the next slide, please? Thank you. So a mother-child health record that was given at the prenatal consultation, where we could have an overview of the different vaccinations of the child with a very strict timetable, schedule according to the age of the child. It means that the state has invested very much in this strategy education, with people going to remote areas in the countryside, doctors and nurses, so that prenatal consultations could be organized and vaccination campaigns carried out. So again, once a child is born, families are very much reassured regarding the health status of the child. Vaccination takes place, and measles, for instance, can be avoided. So this is an additional incentive for families to register new births in a given timescale. Next slide, please. The second lesson I would like to share with you is the following. Development policies and civil registration systems will be reinforced mutually. There is a strong pressure for health services and education services, means that lots of families will go and register new births, which in its turn will lead to more municipal centers, district centers, and more resources in staff, in equipment, to be able to tackle that high demand for civil registration. Knowing that civil registration is linked to the possession of a national identity card, so linked to the fact of having a legal identity. This in turn will lead to more resources to absorb this increase in registration demand. And apart from this identity card, there is going to be a higher pressure in favor of having a legal entity. Next slide. So this brings me to my third or fourth lesson, which is social acceptation. In less than 20 years, starting in 75, starting at the end of the 70s, the fact of registering civil registration today becomes commonplace. There is a real banalization of this behavior. Families go and register new birth, and they even accept the binding aspects related to the fact that they have a national identity card. So they accept this binding nature. And a final lesson, the modernization of the system led to more efficiency, to social protection systems that are now more efficient. At the moment, the country is developing a digitalization approach for civil registration and establishment of legal identity. As in Namibia, we have a unique identity, national identity number that individuals receive as of their birth. But here, what is maybe different from other countries is that each institution has its own sectorial national number. And there is a kind of comparison, or if you want to check the information regarding a family or a person, you can have a look at the different databases. And at the same time, civil society is very active, and this has to be underlined. Indeed, civil society is very vigilant to limit the very intrusive nature of identification, whether it be through the digital identity card, which is in process, which is under development. And they also, civil society also puts safeguards regarding this unique identification number. So this brings me to the end of my presentation. Thank you very much for your attention. And of course, I would be pleased to answer to any requests for additional information. Thank you.
Farat, I think that was a really interesting presentation, and I think the modernization and the efficiency of digitizing has been a key success factor. We have very few minutes to the end of this webinar, so I just want to pick at least a question for each speaker based on what has come through before we go into the closing remarks. And I'd like to start with you, Annette, then I'll move to you, Mia, then Tuli, and Farat in that order. Annette, I'll pick the question from Ed Dufus. And his question is, for the governments that have invested in the solid foundations of universal registration of births and deaths, what was the deciding factor not to merely rely on digital identity credentials, so ensuring uniqueness through biometrics captured at maybe age 16. So what was the deciding factor to administer social protection? Annette, you have a minute or or less to respond to that, and then I'll come to you, Mia.
Okay, thank you very much, Karen, and thank you very much, Ed. It's a very good question. I think, I believe very strongly, you need that evidence for
Annette,
birth
can
in
you
order
hear
to.
us?
Yes, I can hear us, and I'm speaking. Can you hear me?
I can hear you, Annette. Keep going.
So as we maybe as we wait for Annette to.
Okay, I've muted Karen. Annette, please keep going, and I'll let Karen know.
Okay, so it's very important in order to establish a trustworthy identity, you must have evidence for birth. And if you look at it in a social protection perspective, it's also clear that social protection is not just for people above the age of 16. You need a trustworthy credential already from birth, so children can access benefits. Otherwise, it would be very difficult to actually distribute grants for children. And of course, if we look for children who's lost their children, they also need access to benefits or that has been left by their parents or inheritance left by the parents, and benefits that, for example, in Namibia is often for orphans. Thank you.
Apologies for the technical hitch on my end, but I want to come to you now, Mia. And the question, just a minute, I want to pick the question for you. So this came for you for Chile. So countries with well-functioning CRVS ID systems are characterized by high levels of trust and confidence in national administrative institutions. But many countries today are in or emerging from civil conflict, and there are high levels of district of government and among different political or ethnic groups. How can CRVS systems be protected or developed in such circumstances? Can social protection provide an entry point for building confidence and repairing CRVS? And I actually picked this question and the latest that came from Irina on how do you build trust in communities? How was partnership with communities? How did it work? So Mia, do you want to take that question in combination, and then I'll come to you, Tuli?
Yes, I'll be happy to address that question. Trust in the systems is not something that is built up overnight, and it takes time. And the dialogue takes place on several, on different levels, but it's about a dialogue. It is also about the government or the state being able to show that there is that there are benefits associated with registering, and it's also for them to be able to distribute fairly the resources that are available to social and economic development in the countries. I mentioned in my presentation that it takes time to build up these systems. And I think you, Karen, said decades, and I would say several decades. And this was also what happened in Chile. There is dialogue, there is ongoing dialogue. It happened in other countries as well. An example is the system in Peru, where annual surveys made by the civil society indicate that people in Peru trust the civil registry and identification system there more than they trust the Catholic Church. But it's through dialogue, patience, and time, and really proving to citizens, residents, marginalized groups that there is room in society for them as well. Thank you.
Thanks, Mia. I want to come to you now, Tuli, and I'll combine a question we received in French from Khadija Thiam. I hope I'm getting this right, and I'll combine that with one from UNFP and one that has just come in. So, what has been the factor of success for death registration to 93.7%? Many countries are struggling with death registrations. Why has it been successful in Namibia? But also, can you talk about the indicators on marriage and divorce? I think the question that, and just what are the statistics from Namibia? The last question we received from Charles has been, marriage registration is a neglected cousin in CRVS, and how do you integrate it to the system? So over to you, Tuli, for that question. We'll come to you Forat right after that, and then we'll close.
Okay, thank you. I hope I'm audible. Yes, I can see my mic is moving. What has been that factor that has increased death registration? On death registration, there are usually benefits that are not a benefit, benefit in inverted commas, that follow that. You will not be able to claim a funeral benefit without a death certificate. You will not be able to close off bank accounts and everything else that the person might have had. So in a way, you can say it's because there are incentives that are attached to it, but also the law provides that you cannot bury a body without a burial order. And you cannot have a burial order without having registered the death. And it's also, I think, one of the factors has also been that most people die in a hospital, and hospitals now do e-death notifications. And those that do not die in hospitals, the police take over and do what they need to do. The court would be involved in the inquest if the death is suspected not to have been natural, or a post-mortem would have to be done after a body has gone through the hands of the state. That death would have to be registered. So I think that has been quite key in ensuring that death registration is quite high. Then there's the question on marriages. Why is there no mention of marriages? I think it was just the design of the presentation, but it is compulsory to have all vital events registered. So marriages are also registered in Namibia. Marriages are solemnized by marriage officers who are not staff members of the Ministry of Home Affairs, but it could be a magistrate or a minister of religion. After the solemnization of the marriage, then the registration needs to take place at the ministry responsible for Home Affairs. It is one of the aspects that we are also working on. Marriages are an integral part of the national population registration system, because everybody's vital events are connected to the one profile using one unique identifier. For the own self, I think I had lost connection for a while. Yeah, I'm back. There is still work that Namibia needs to do on the registration to make from the manual system to electronic notification as soon as the marriage actually takes place. So it is also an integral part of the national population registration system. And of course, those social protection benefits that accrue as a result of a marriage also are benefiting from the population registration system. If a husband dies the spouse, the wife would need to indicate that there is indeed a marriage and here is the marriage certificate. One day we can talk about how the whole NPRS is built, but marriage is an integral part of it. Divorces as well. Does that cover everything, Karen?
It does, Tuli. Thank you so much. Just one more question for you, Forat, if you can answer maybe in the next minute or so. I'm keen to just get the experience from Tunisia on building trust. What are some of the, what are some of the ingredients for building trust? And would you please combine this with Khadija's question on some of the challenges, sorry, not Khadija, but some of the challenges that you faced or you confronted in terms of what are the country challenges. So Forat, if you're there with us, please respond to these two questions.
Unfortunately, one can't hear him. Forat, êtes-vous toujours avec nous?
Forat, please go ahead. I've unmuted your mic.
Sorry, we still can't hear Forat.
Technical hitch with Forat's mic to respond to the question. But just to let you know that we'll want to respond to all these questions as a follow-up to this webinar, where we'll also share the presentations and the recording. So there you are, Forat. Do you want to
hear me? Can you hear me? We
Karen?
Karen?
Go ahead, we can hear you.
Apologies, he's still inaudible.
I think we should probably move on.
Okay, so just as I was saying, thanks, Colleen. Just as I was saying, we'll be responding to all the questions that we did not respond to during this webinar, as well as sending around the presentations and the recording. So I sincerely apologize. We've gone over about 4 minutes. So I want to pass this back to Kristen just to give her closing remarks and to close the webinar.
Okay, thank you very much, Karen. It's Annette here, though. But thank you very much, everybody, for joining today. It's been very interesting, and I really hope that you have all enjoyed the presentations, and we will answer to all your questions. So, as said in the beginning, I think that it's been demonstrated from both Namibia and Tunisia and Chile that there's very close relations between civil registration and social protection systems, and the mutual benefits are many, and they rely on each other to succeed. So I think I will just kind of echo what Mia already said. There's absolutely no quick solution. There's no easy solution. These systems take years to build, but it is possible to build them absolutely from the ground. Also, each country have to take their own pathway. There's no one to size fit all to the model to strengthen the systems. Just in the end, I would also like to say that this is obviously our first attempt to document these beneficial relationship, and it's very evident that it warrants for further explanation and empirical research. And I very much hope that you will join us for our next webinar on Tuesday, the 22nd September, where we are going to take a closer look at South Korea and Argentina, and specifically on their response to the COVID pandemic in terms of issuance of emergency grants. Kristen has been sharing links of our free public resources during this webinar. And I encourage you to go into our website and look at many other things that we have published. And at the same time, many of you are CRVS experts and practitioners, and we have just this month also launched a new directory of experts for expertise and support. And I encourage you to go in and apply to become members. There's different categories, and it requires different requirements for each of these different sectors, but go in and have a look. I think Kristen is now posting the address in English and French in the comments. So for last, I just want to thank everybody on the behalf of the Center of Excellence who's been part of compiling this compendium, and of course the authors and presenters today, Mia Tulemege and Farad, and also thank you for Karen and Colleen for moderating and doing all the technicals in the background. And thanks last of all to all of you for joining today. Thank you very much from Ottawa. Bye.